I'm Dr. Barkley Weisberg of Eastern Virginia Family and Cosmetic Dentistry, and I wanted to spend a few moments today speaking about what might be the best toothpaste for you and your family. Now, ultimately, there are a number of different ingredients in toothpaste. The primary active ingredient is going to be fluoride. That comes in various different forms in terms of sodium fluoride, sodium monofluorophosphate, as well as stannous fluoride. Dental caries is still the most common chronic disease both in children and in young adults. The fluoride is really critical because it helps in terms of remineralization and reducing the vulnerability of the teeth to acid attacks, and as well in terms of to decay. From there, another critical ingredient is in terms of abrasives. The abrasives are really important because they help disrupt the formation and facilitate the removal of plaque, which if it sits there is going to mature and become calculus or tartar. There are various different formulations or ingredients that are used as abrasives. Most commonly, it's really going to be the phosphate salts in terms of sodium pyrophosphate. Other common ones include silica, calcium carbonate, sodium bicarbonate, and zinc citrate. And all these are really critical because by removing the plaque and getting it off the teeth, we reduce the incidence of gingivitis and as well help prevent the progression of gingivitis into more serious conditions like periodontal disease. From there, one of the common questions I get is in terms of the best toothpaste to help reduce sensitivity. And now this is kind of a complicated question, really because ultimately you need to address the source of the sensitivity. From there, we obviously want to control the symptoms, but it's really critical to address the source of that sensitivity. The most common ingredients that help in terms of sensitivity are going to be potassium nitrate and stannous fluoride. These two act through slightly different mechanisms. The potassium nitrate, it helps reduce the sensitivity of the nerve, whereas the stannous fluoride helps to occlude the tubules and therefore reduce the sensitivity. Other opportunities in terms of sensitivity reduction include prescription strength toothpaste, as well as toothpaste. There's some that are some literature that's coming out recently in regards to the inclusion of arginine as an ingredient, and so that those can be different opportunities to help with that sensitivity. In regards to the prescription strength toothpaste, over-the-counter toothpaste in the United States basically come from 1,000 parts per million to 1,500 parts per million. And ultimately, this kind of ties back to the amount of fluoride in the toothpaste, as well in terms of the balance for each specific individual. Ultimately, when we want to try to change that balance, we can look in terms of trying to change what we're doing at home. We can look in terms of home care, in terms of diet, as well as in terms of exposure to fluoride. With the prescription strength toothpaste, they can have up to 5 times as much fluoride as the over-the-counter and can really facilitate in terms of trying to tip that balance. Other additional ingredients that are used in some of the prescription toothpaste include calcium phosphate, and these can really help with some of those white spot lesions that some patients have on their teeth. From there, another common question is in regards to the best whitening toothpaste. One of the major challenges with whitening toothpaste is in regards to limited time of exposure. The toothpaste acted through 2 different mechanisms. One addresses intrinsic stain and the other addresses external stain. In terms of trying to address the internal intrinsic stain, different forms of peroxide are used, either calcium peroxide, carbamide peroxide, or hydrogen peroxide. And basically these help in terms of removal of interprismatic matter. From there, like we talked about earlier, the different abrasives in the toothpaste, those help to remove the external stain they can develop on the teeth, basically in terms of what you're eating in your diet. Next, in terms of ingredients, most toothpaste do have some types of flavoring in them, as well as some type of foaming agent. In terms of the flavorings, it can come in mint, can come in fruit. A lot of the pediatric children's toothpaste will come in some type of fruit. It can come in cinnamon, bubble gum, and many others. One of the important things to be aware of, especially in regards to the flavoring, has to do with that some patients can have sensitive tissue and can have reactions to different ingredients, even in toothpaste. If you do have a reaction to some type of toothpaste or some type of ingredient, really make sure you discuss that with your dentist. From there, if that irritation is present for more than 2 weeks, it's really critical that you get in and be seen. The next that we were talking about was in terms of the foaming agent, and really that's what's known as a surfactant. One of the most common ones used is sodium lauryl sulfate. Now, one of the big things with the foaming agent is great because it helps to remove some of the different debris on the teeth, but we need to make sure that we're not using too much and having too much foaming in our mouth, because it can actually inhibit effective brushing. For adults, they recommend a pea-sized drop of toothpaste. For the pediatric population, especially kids who can't spit, they recommend a grain of rice. In terms of the sodium lauryl sulfate, recently there have been some reports linking a reduction in recurrent aphthous ulcers and toothpaste that are SLS free or sodium lauryl sulfate free. One of the challenging things with that relates to finding an SLS free toothpaste that actually contains fluoride. Both Burt's Bees and Closys are two companies that do make formulations that are both SLS free and contain fluoride. So kind of stepping back a little bit, it's really important kind of in terms of what we're doing at home. We want to make sure brushing for 2 minutes twice a day, at least. Ideally, we're going to brush after breakfast and then last thing before bed. You want to make sure you're using the proper amount of toothpaste. Like we discussed earlier, for adults, a pea-sized drop. For pediatrics, especially like I said, the children that can't spit well, using a grain of rice size. From there, you do want to make sure that whatever toothpaste you're using does have an ADA seal on it. That's really important. There have been a lot of different toothpaste coming out over the years. Recently it's been with charcoal, and there's sometimes some things in those that you really don't want to have in your toothpaste. And so, making sure that whatever toothpaste you're using does have an ADA seal is going to be really important. From there, you want to look in terms of history and listening to what your body's telling you. If you're having a major problem with decay or with bleeding gums or with sensitivity, that's our body's way of communicating with us. So you want to make sure and listen to that and work to adjust accordingly. And if you don't know how to adjust, talking with your dental hygienist or your dentist in terms of how you can start to get those issues under control. Ultimately, I hope that this short segment kind of gave some insight in regards to what might be the best toothpaste for you and your family. And hopefully we'll look forward to checking in again soon.